seen a true transformation in the health sector. And I can say it with authority as a governor. In many aspects. Over the next 2 days, we'll have opportunities to go into the details of this transformation from our primary care networks, where we have, CHPs. In Nairobi, we have 7,820, covering 780,000 households, to the provision of essential services, Your Excellency, reduction of maternal mortality. Hospitals like Pumwani, which would be on the news every day for the wrong reason, have now 0% maternal mortality out of 16,500 deliveries. Your Excellency, we've seen hospitals like Riruta doing 100 deliveries in a month now. New maternity services in Kayole 2, in Mathare North, across the city. The story of the health transformation is something to talk about. We have facilities that would get 100,000 shillings in 2 years. In a year, getting 4 million shillings a month, allowing them to invest in healthcare and to invest in serving our people. Your Excellency, allow me to conclude by saying, because we'll get into all these details, today it was really just to welcome us all. Our Constitution has been hailed as being one of the most progressive on the continent. It has mainly been hailed as being progressive because of the kind of rights. The first generation rights, Your Excellency, are civil liberties, where government is asked to step back to allow people to have the right to, do a number of things. But the second generation rights are what we call positive obligations. Positive obligations require government to actually do something. When people talk about constitutionalism in this country, constitutionalism is not just about maandamano or making noise. Constitutionalism is about fulfilling the Constitution. The right to health would not fulfill itself. It has to be designed. It has to be planned. It has to be thought out. There has to be legislation. The right to housing will not deliver itself. It has to be planned for. And Your Excellency, I can say, and I dare say, if there has been a leader who has fulfilled the Constitution of the Republic of Kenya, it is William Samoei Ruto, by these actions that you've taken. So people should not romanticize and preach on pulpits about Katiba. This is what Katiba is. Giving that right to every Kenyan, that health is no longer a privilege for the few. It is not a privilege for those who have money. That just because one person gets unwell, families have to sell their livestock, to sell their investments. What you're doing, Your Excellency, I believe this will be one of your most enduring legacies, the transformation of healthcare in our country. And I think our President deserves applause for what he's been able to do. Your Excellency, we are proud in Nairobi, in SHA. Mheshimiwa Moses Kuria was giving me an analogy because of the numbers we have. The most tech-savvy country in the world is Estonia, where we go to benchmark. The people registered in Nairobi and SHA are 2 times the population of the whole of Estonia. More than 3 million people registered and more than 1 million actively paying every month. And through the DHA dashboard, I can see who is self-employed, who is employed, and how they're doing. So we really thank you. And want to really congratulate Mheshimiwa Duale. You have really led the way in healthcare. Your PSs, Oluga, who we are very proud of as Nairobi, and PS Mary Mudhoni. Allow me to also salute the thousands of community health promoters across the country who are bringing healthcare to the people. Before, we used to tell the people to go to hospital. These days with the CHPs, the hospital is going to the people. And that has reduced greatly the cost of health service delivery in this country. I'm sure that investment can be quantified by our minister and by the team here. Your Excellency, allow me at this juncture to invite the chairman of the Council of Governors to also come make his remarks and introduce the governors, the many governors who are here. Your Excellency, we have members of parliament, we have senators I can see, we have members of the National Assembly. I hope at some point they'll also get full recognition and introduction by the minister as he comes. Tupigie chairman wetu makofi tafadhali.
Your Excellency, Dr. William Samoei Ruto, CGH, the President of the Republic of Kenya and Commander-in-Chief of the Defense Forces, Your Excellency, Honorable Professor Kindiki Kithure, Deputy President of the Republic of Kenya, Your Excellency, Dr. Your Excellency, Dr. Musalia Mudavadi, Cabinet Secretary, Prime Cabinet Secretary, and Cabinet Secretary for Foreign Affairs, Your Excellency Dr. Moses Wetangula, Speaker of the National Assembly, All Excellency Governors, Cabinet Secretaries, PSs, Members of Parliament, development partners, ladies and gentlemen. Your Excellency, it's a great honor to join you at the Kenya Health Summit 2026 on behalf of the Council of Governors and the 47 county governments. I wish to appreciate the Ministry of Health for convening this important summit and for the continued engagement with county governments in advancing the health agenda of our country. The theme of the summit, Reform Delivered, Health as a Right, speaks directly to the responsibility we carry as leaders. Health is not simply a sector of government, it is a constitutional right and a fundamental determinant of social and economic well-being of our people. Your Excellency, we meet here more than 16 years since the promulgation of the Constitution of Kenya 2010, which fundamentally transformed our system of governance. Devolution has evolved from a constitutional aspiration into one of Kenya's most consequential governance reforms. Today, Your Excellency, our emphasis is that we can do so much for Kenyans in the health sector through coordinated intergovernmental implementation, functional service delivery, and measurable patient outcomes. And I want to confirm on behalf of the COG that we have actually achieved so much in the space of healthcare. We have achieved tremendous results over the past 4 years through your leadership, Your Excellency, and through the bottom-up economic transformation agenda, BETTER, which prioritized universal health coverage for all Kenyans. I wish to highlight but just a few areas that demonstrate the progress we have made and equally the work that remains before us. In primary health care, over 107,800 community health promoters, CHPs, were deployed under a 50-50 shared financing model between the national and county governments. This has expanded health service availability at the primary level. Primary care networks, PCNs, have increased from 89 to 277. On health financing, Your Excellency, since the inception of the Social Health Authority, counties have cumulatively received 46 billion shillings, out of which 31.4 billion has been paid to hospitals through the Social Health Insurance Fund, SHIF, and 14.2 billion has been reimbursed to primary health care facilities. 98% of public facilities have been onboarded on the Social Health Authority, SHA. Through collaboration between the two levels of government, 32.4 million people have been registered under the Social Health Insurance Fund, representing a significant increase from the 7 million people previously registered under NHIF. Counties have also strengthened emergency response with 304 of our ambulances out of the 506 that we run currently already integrated into the National Ambulance Dispatch System, improving referral linkages and timely response to patients requiring urgent and specialized care. Your Excellency, through your initiative under the National Equipment Service Program, NESP, the county governments have now specialized equipment at all levels. This has gone a long way in improving the capacity of counties to handle critical patients and other access to specialized care. We now have MRIs, ultrasounds, blood equipment, blood chemistry equipment, you name it, in the most peripheral of places, Your Excellency. Through the UHC reforms and digitization, the Digital Health Authority has been able to distribute 42,300 digital devices across level 2 to level 5 facilities, processing SHA claims in all 47 counties. These are but a few areas that the reforms in the healthcare sector have greatly improved. Your Excellency, this summit is about consolidating gains, celebrating what we have achieved, taking stock, and charting out the way forward on what else needs to be done. We acknowledge certain challenges, especially in workforce gaps and industrial relations, and together we will work to solve those. Your Excellency, as the Council of Governors and the 47 county governments, we reaffirm our commitment to working with the national government, development partners and the private sector, civil society, health workers and communities to consolidate the gains thus far and to address the gaps that remain, as I said. Let this summit mark a renewed phase of cooperative governance, shared accountability, and accelerated implementation. Let's build on what has worked, confront what has not, scale innovation emerging from both the national and counties, and ensure that our reforms are felt where it matters, as it's already happening. Together, let's deliver a resilient, equitable, responsive, people-centered health system where quality healthcare is not a privilege but a right for every Kenyan in every county and at every level of care. Your Excellency, I want to conclude by observing that I have had politicians out there saying that the first thing they will do if they get into office is to scrap SHA. Your Excellency, actually one politician said, on day one, I'll scrap SHA. To replace with what? Your Excellency, your administration is doing its best to fix everything. I think what we have failed to fix as a country is the toxicity of our politics. I want to confirm that hospitals in the most peripheral of places today receive funding directly from SHA. And in many cases, and I've said this before, the challenge we have as governors is to control what they do with that money so that they're not using it to just do more pavements and more renovations, but use it to things that can actually help patient care. This would not have been achievable without SHA, Your Excellency, and without all the policy changes. Your administration has thought through everything from financing to policies to digitization, and as a council we appreciate the partnership that we have. Your Excellency, let me just take a minute to introduce the governors who are here. Excellency Governors, you may just stand where you are. I hope I can see you. Thank you very much. From the very end there, we have Professor Barchok, Governor Bomet. We have Governor Gladys Wanga, Governor Homa Bay, Gideon Mungaro, Excellency, Governor of Kilifi, Fatuma Achani, Governor of Kwale, Governor, I call him Kipiego Arapsang, Governor of Nandi. We have Governor Simba Arati. We have our Chair of Health, Governor Abdul Samad Sharif Nasir. And we have Governor Wesley Rotich, Governor of Elgeyo Marakwet. And we have Governor of Nairobi, our host. Your Excellency, I want to end by saying that we look forward to very engaging deliberations for the next 2 days to discuss where we are, to consolidate gains, to appreciate ourselves that actually we have achieved a lot. And for those saying that they will scrap SHA, it's akin to telling us that they will destroy the roads that have been tarmacked once they get into office. I end it there. Thank you, Your Excellency.
Thank you very much, Your Excellency. Before I call the next speaker, I would kindly request the PSs who are in the house to stand up and just wave to the crowd. We have PS Mohamed Dagar, Transport, PS Judith Pareno, Justice, PS Ismail Madei, Special Programs, PS Hariki Mutai, Mining, PS Beatrice Inyangala, Higher Education, PS Idris Dokota, Cabinet Affairs, PS Joel Oromonyang, Public Works, PS Ann Wangombe, Gender Affairs, PS Karen Agengo, Children's Services, PS Cyril Wagunda, Public Investment, PS Joseph Mutari, Social Protection, PS Aurelia Rono, Parliamentary Affairs, PS Abubakar, Investment, Susan Mangeni, MSME, and PS Jacobs Fikirini, Youth Affairs. Oh, and our SG, Solicitor General for the Government of Kenya. Your Excellency, transforming healthcare requires bold leadership and a steadfast commitment to delivering comprehensive reforms. I now would wish to, it's my distinct honor to invite my Cabinet Secretary, Honorable Aden Duale, the Cabinet Secretary for Health. A round of applause.
Your Excellency, the President of the Republic of Kenya and the Commander-in-Chief of the Defense Forces, Your Excellency, the Deputy President, Professor Kindiki, Your Excellency, the Speaker of the National Assembly and the Head of the Legislature, Speaker Moses Wetangula, Your Excellency, our Prime Cabinet Secretary, Honorable Musalia Mudavadi, Your Excellency, the Chair of the Council of Governors, Governor Abdullahi, Your Excellencies, Governors present, Cabinet colleagues, Your Excellency, the Cabinet Secretary for Housing, my sister Alice Ohome is here, the Cabinet Secretary for Tourism, Rebecca Miano, the Cabinet Secretary for Gender, the Cabinet Secretary for Environment, the Attorney General, my brother, the Cabinet Secretary for Sports, the Cabinet Secretary for Energy, the Cabinet Secretary for Education, the Cabinet Secretary for Water and Irrigation, and the Cabinet Secretary for Labor. Your Excellency, allow me also to recognize the chairs of our Parliamentary Health Committee, the Senator Mandago, the chair of the Health Committee from the Senate, and the entire leadership, Dr. Nyikal, the chair of the National Assembly Health Committee. Your Excellency, allow me also to recognize the entire leadership of the Ministry of Health at the national level. Allow me also to recognize the entire leadership from the CECs of our entire 47 counties who are present here, civil society representatives, NGOs in the health sector, our development partners in the health sector, our diplomatic representatives who are here, a number of diplomats are here. Your Excellency, the heads of health agencies, health workers, citizens who are here this morning, allow me to welcome you and every delegate to the Kenya Health Summit 2026. This is the largest gathering, Your Excellency, of Kenya's health sector ever convened in this republic, and it is fitting that it takes place under the theme that is a statement of fact rather than a wish. Reform delivered, health as a right. Your Excellency, in August of 2022, the people of Kenya were offered a choice. They were not offered slogans. They were offered a plan, written down, published, in which universal health coverage stood as one of the 5 pillars of our national transformation. Kenyans read that plan and they give it their mandate by electing you as their 5th president. 4 years later, we have come to this hall to do something that is rare in the politics of our country and in our region. We have come to place that plan side by side with a record and to invite the whole country to compare the two. And I want to say something about why this was possible, because it is not a technical story we want to say. It's also a political one. Every government that has ever governed Kenya knew what was wrong with our healthcare system. The diagnosis was never a secret, but it is set in reports. It was found in commissions. It was found in expert panels, in the exit notes of the departing officials, including presidents. But what was missing was also never the analysis. What was missing was a head of state willing to spend the political capital. Your Excellency, in the first year of your administration, you chose to retire an institution that has served this country for nearly 6 decades, that employed thousands, that had a constituency of its own, that has defeated the reforming intentions of every government before you. You were advised, and I know because some time is set in those meetings, and it could have been safer for you to amend, it could have been safer for you to postpone, or to pilot the way some of your predecessors have done, or to appoint yet another task force. You declined all those offers. You went to Parliament as our president, and you asked for the 4 new laws, and that's why the Speaker of the National Assembly and the Committees of Health are here. And when the transition proved difficult, as deep reforms always do, you did not retreat into silence. You went out and explained it publicly in every county in this republic. And that's why we are here today. Not because the Minister of Health is clever, but because this reform had a political ownership at the very top, sustained for 4 years, and the technical machinery built deliberately underneath. Your Excellency, you will shortly place before this nation, is not my duty, the full account of universal health coverage known as Taifa Care. You'll tell the country the coverage we have done. You'll tell the country the contribution, the payments, and the outcome. And allow me, therefore, Your Excellency, to report to this summit on 3 matters that fall directly to this ministry and which determine whether any of that money ever becomes care, the medicines, the equipment, and the people. Your Excellency, a health system on health commodity security, a health system is only as credible as the medicine on its shelves. When this administration came into office, the national order fill rate at Kenya Medical Supplies Authority stood at 35%. In plain language, a facility that ordered 10 essential commodities received fewer than 4. Today, that rate stands at 95%. We restored the authority's balance sheet by recapitalizing KEMSA through a 10 billion shilling credit facility arranged with one of our commercial financial institutions. And we did that because there's no supply chain in the world that functions without working capital. We have operationalized the Embakasi Supply Chain Center. We have strengthened our regional distribution hubs in Kisumu and Mombasa. And we have moved the entire chain from paper to platform. Your Excellency, today KEMSA supplies more than 11,400 health facilities, and 54% of everything it distributes goes to primary health care at level 2 and level 3, the dispensaries and the health centers, where most Kenyans seek care. What this means for an ordinary Kenyan, Your Excellency, is very simple. The mother who walks to a dispensary with a prescription in her hand now finds the medicine at the end of the queue, and not a referral to a chemist she cannot afford. On National Equipment Support Program, equipment, Your Excellency, because a clinician without a diagnostic is a clinician guessing. Under the National Equipment Support Program that you introduced as one of the key pillars of universal health coverage, as of 30th July 2026, we have installed medical equipment valued at 9.68 billion shillings in 251 health facilities across our 44 counties, showing 239 county facilities and 8 national facilities. Let me be very specific about what that means at the bedside. It means 36 CT scans, it means 2 MRI machines, it means 52 digital X-rays, and it means 72 ultrasound machines that have been provided. Consider what that changes. Not long ago, a Kenyan who needed a CT scan had 2 options: travel to Nairobi or go without a diagnosis. Today, that equipment is available in the great majority of our counties, and it's paid for by Taifa Care, not by the national government and not by our county governments. Over the last 4 years, this government has deployed 24,573 healthcare interns to all the 47 counties, Your Excellency, at an investment of 19 billion shillings. An annual placement has risen from 3,373 in the financial year 2022-2023 to 6,800 in 2026, nearly doubling the single admission for our young graduates from our colleges. This has allowed young Kenyans who for 4 years ago could have completed their training and go home to wait, get a placement. We have also sponsored 262 medical registrars across 35 specialties, so that counties who have never had a single specialist are now growing their own. We have released 3.5 billion shillings to settle the accrued basic salary arrears owed to our doctors. Under your direction, we are employing 5,000 additional nurses and midwives are being recruited. All this happened under your leadership, Your Excellency, in the last 4, and we will showcase them as the 2-day health summit progresses. Your Excellency, allow me now finally to acknowledge our partners in this work. To our Excellencies, the governors, health is a devolved function, and every figure that will be quoted in this hall was earned in a county facility by a county staff. This reform has been a genuine partnership between the 2 levels of government, and I want to thank our governors for that. To our development partners who have stood with us, Kenya, through a very difficult period, of global health financing, thank you for the confidence you have shown in our healthcare system. To our private and faith-based providers, our professional bodies, our unions, you are inside this system, not outside. And this reform is stronger for your involvement. And to the Kenyan healthcare workers who are here and those who are listening to us, who are the reason any of this, who are the reasons that a patient reaches them at any time. This government sees you. Tomorrow, this summit devotes an entire plenary to your future. Over the next 2 days, Your Excellency, we will do an examination of our healthcare financing, primary health care and community health, human resource for health, health products and technologies, health security, digitization of the healthcare system, and our specialized and referral services. Her Excellency, the First Lady, will do a session tomorrow on maternal and newborn health at the plenary. We'll have the Deputy President who will run another plenary tomorrow afternoon before we have a joint plenary where we want to listen to the people of Kenya, and His Excellency the President, as a listening leader, will be sitting in that forum. Your Excellency, just to conclude, tonight we have the Town Hall Health Summit, and we want to answer all the questions. We want to answer all the questions concerning the healthcare system in Kenya. We want to answer all the fake headlines for 4 hours. Because as I said, we had a plan, and now we are presenting the record so that the people of Kenya can compare what we promised, what we planned, and what we have delivered as of now. To Your Excellency, and more important, is in that healthcare at a health summit town hall tonight, we will have testimonials from the stakeholders, what our unions see in terms of healthcare workforce reform, our patients, professional associations like Kenya Medical Association, and many others. Our governors will be there. The entire leadership of the counties will be there. But Your Excellency, just to answer some of the basic questions that we have been asked, is that the architecture of universal health coverage, at the bottom is the primary health care, which is fully funded by your government. 27 billion in the last 2 financial years. 19 billion in this financial year. Why do we invest in primary health care? We invest in primary health care because 70% of the disease burden in our country is at the primary health care. And Your Excellency, with those many remarks, it's my honor and duty to invite the Speaker of the National Assembly to come and give us remarks on the role of the legislature in the delivery of healthcare system in our country.
Your Excellency, the President and Commander-in-Chief of our Defense Forces, Your Excellency, the Deputy President, and all established protocols followed, I'm here and I'm honored to address this health summit on behalf of Parliament. Your Excellency, over these 2 days, delegates will speak of hospitals, will speak of funds, we'll speak of medicines and equipment, we'll speak of systems, we'll speak of outcomes. I wish to speak about one aspect that precedes all of them, and without which not one of them would exist, and this is the enabling legal framework. Your Excellency, Article 94 of our Constitution provides that the legislative authority of the Republic is derived from the people and is vested in and exercised by Parliament. At our independence, Your Excellency, our founding father pronounced that the incoming government of the people of Kenya was going to focus on fighting three things: poverty, ignorance, and disease. Over the years, efforts have been made in the health sector to achieve the war against diseases. In 1966, the National Health Insurance Fund was founded, and later in 1998, it was cemented into an Act of Parliament as NHIF, primarily to provide for medical cover for formal and informal sectors. The fund was operated by the National Hospital Insurance Fund Board of Management, and it relied on tiered flat-rate monthly deductions as its contributions rather than proportional income scaling. Over the period, Your Excellency, the NHIF faced massive systemic corruption, losing billions of shillings through ghost clinics, inflated claims, collusion between rogue medical facilities and state officials. The reform journey that your government started, Your Excellency, has had the effect of addressing all this. Whenever you speak to any member of Parliament, Your Excellency, you'll hear always the same story. Desperate families calling at midnight about hospital emergencies and their attendant bills, their names being forced on fundraising committees and cards that are circulated without their knowledge, standing at hospital gates negotiating for the release of a patient, and at mortuaries negotiating for the release of bodies to their loved ones. Parliament understood the necessity of reform because parliamentarians have constant interaction with the needy in the population. The Departmental Committee on Health in the 12th Parliament had recommended, as it exited on the 8th of June 2022, that its successor should establish a facility improvement fund for county public health facilities. Section 104 of the Health Act of 2017 had also directed that legislation on health be enacted within 3 years. That instruction had remained unfulfilled. The National Hospital Insurance Fund, born in 1966 and governed by the 1998 Act, had long since been overtaken by the structure of our economy and dynamic social needs. So, Your Excellency, when you brought this agenda to the House of Parliament in your administration, you found an already convinced Parliament. Parliament had been waiting for the executive to act, and it took courage from 1963. All successive governments had made half-hearted attempts to achieve what we now have in our country. In the year 2023, Parliament considered, interrogated, amended, and passed 4 statutes, which Your Excellency assented to on the 19th of October of the same year. These were, first, the Primary Health Care Act, number 13 of 2023. It established for the first time in our history a legal framework for the delivery and management of primary health care through primary health care networks, and it placed our community health promoters on a statutory footing rather than leaving them to the whims of successive government initiatives. The second was the Facility Improvement Financing Act number 14 of 2023. This, anchored on Article 207 of the Constitution, permits a public health facility to retain and manage the revenue it generates. In plain language, money earned at a dispensary in Kimilili or Kilifi or Kachiliba is now spent and ought to be spent at that dispensary. The third piece of legislation was the Digital Health Act number 15 of 2023. It discharged the unfinished obligation of the Health Act of 2017, established the Digital Health Agency, mandated a comprehensive integrated health information system for the whole Republic, and gave every Kenyan statutory protection over their personal health data. The fourth, the Social Health Insurance Act, the much talked about SHA, over which yours truly here was taken to court 6 times. It now, together with it establishes 3 public funds for primary health care, for social health insurance, and for emergency, chronic, and critical illnesses. 4 statutes passed in one session of Parliament, Your Excellency, was unprecedented. It is the most consequential body of social legislation enacted by any parliament in Kenya since independence. Far-reaching reforms are not always readily embraced and accepted. These 4 health bills were met with robust public debate. There were those who benefited from the gaps, flaws, and shortcomings of the status quo who did not welcome the reforms. These were in the minority. The majority of Kenyans saw this as a right trajectory in mitigating the myriad challenges that the health sector faced, and saw these legislations as a Damascus moment for our health sector. As we speak today, the number of Kenyans registered under the universal health coverage being a whopping over 30 million compared to about 8 million under NHIF will convince every doubting Thomas on the vision and foresight that informed these reforms. Numbers do not lie, and in law we say, res ipsa loquitur. Things speak for themselves. Under the Constitution, Parliament appropriates and divides revenues between the 2 levels of governments. It then has the mandate to ensure prudent use of those resources so that Kenyans get value for their money. I want to assure this summit that this is a duty that Parliament holds sacrosanct and will discharge without fear or favor. Parliament shall always ensure that any person or entity entrusted with management of public resources is accountable to the letter. Your Excellency, ladies and gentlemen, there are cases within the laws I have cited that require no financial contribution from citizens. These are primary health care, emergency, chronic, and critical illness. That notwithstanding, the law has set out the Primary Health Care Fund and Emergency Illness and Critical Health Care Fund, which are financed from parliamentary appropriations. Even in such cases where ordinary citizens do not directly pay for those services, the funds draw the money from taxpayers' purse, while the degree and extent of responsibility must remain the same. Your Excellency, ladies and gentlemen, with all these good legislative reforms, questions are constantly raised by members of parliament on issues that this summit needs to address. Number one, rationalization of manpower or health professionals so that citizens in both urban and far-flung rural areas enjoy similar benefits and attention from our health sector workforce, including medical consultants. Two, the preventive and promotive care should be more enhanced to avoid costly curative remedies. Here we should place emphasis on regular physical checkups, clinics, advisory nutrition, fitness, immunization, counseling, etc. Three, cases of hemorrhaging funds from the healthcare system by individuals and health facilities, whether public or private, must be checked, and those found culpable must face the consequences. These include the war against ghost facilities that were very common under the defunct NHIF. I was happy as we went round to see that now we have an AI fraud engine that is dealing with this difficulty. The last, even where the citizen is required to make a financial contribution, the regulators should ensure that no unlawful charges are levied against any citizen. Your Excellency, distinguished delegates, ladies and gentlemen, as I conclude, I want to assure this summit that Parliament will discharge its responsibility to keep the health sector buoyant in our country. We will appropriate sufficient funds subject to the size of the envelope available and other national requirements. We will ensure appropriated funds are put to proper use, and together with the Auditor General, we will discharge these functions fully. We will remain open and ready to support the government with continuing legislative reforms to better existing laws and regulations and to give full meaning to health-related provisions in our Constitution and for the benefit of our country. I thank you.
Your Excellency, distinguished delegates, now it's my honor and duty to invite the Prime Cabinet Secretary to take the program from here.
Your Excellency, the President of the Republic of Kenya, Dr. William Samoei Ruto, Your Excellency, the Deputy President, Professor Kithure Kindiki, Speaker of the National Assembly, Chair of the Governors, and all governors present, my colleague ministers, colleagues in the public space, members of the private sector, medical practitioners, distinguished ladies and gentlemen. Your Excellency, mine will be very brief. This summit is extremely significant. It is a summit that has brought us here so that we can acknowledge a very important thing. That is that the transformation, the delivery in our health system today Your Excellency, you have stayed the course. You stayed the course when people went to court. You stayed the course when there are demonstrations in the street. You stayed the course when the critics were in every corner. You stayed the course even when people were branding you all sorts of names. Today, we celebrate a major transformation in Kenya's health sector. What we are going to witness and what we have witnessed, ladies and gentlemen, is fact and not fiction. Secondly, Your Excellency, I just want to say that one other hat you do wear, because the issue around the medical challenges does not end with Kenya's boundaries, is that you are also doubling up as the African Union champion for pharmaceutical manufacturing in the African Union. Again, a journey that moves beyond Kenya's boundaries to the continental realm, where you have to aggressively support and help transform matters medical on the African continent. Your Excellency, even in the middle of challenges, you have stood out to make sure that Kenya remains a responsible member of the international health fraternity, WHO and other international obligations. When most people were scared to step forward on how Kenya can play its role in the midst of pandemics and epidemics, Kenya stood forward and you said that you shall be a responsible member of the WHO and the conventions that relate to health and the need to anchor and support other countries and other people when there's a medical crisis. You were taken to court, but you stayed the course. Your Excellency, Kenya is slowly but systematically emerging as a medical mecca in the region. The investment that the Ministry of Health is putting in place through the leadership of Duale and his team, the forthrightness, the consistency you have put forward on matters health is systematically and surely transforming Kenya into a medical hub in the region, and that is something that we all need to cultivate and be proud of. Finally, Your Excellency, Kenya Kwanza, the nation first, the citizens first. Your message around the health sector is clearly a very, very critical plank and message that you will have nothing stopping you as long as you are focused on making the citizen come first in this country. We salute you. We also recognize that this is another classic example of perfect partnership between the national government and the county governments. This is a devolved function, but it is a partnership between the national government and the county government. I'm emphasizing this, Your Excellency, because there are times when you say that you want a partnership about other things between the national government and the county government, people proceed to court, forgetting that even what we are doing is a partnership between the national government and the county government. The two levels of government must work together all the time. Let me end by recognizing members of the diplomatic corps who are present. Those of you in the room, please just rise so that we can acknowledge you. I'll not attempt to go by name or country, but thank you so much. Most of you are not just diplomats here, but you're also partners in this journey. Thank you so much for being present. It is now my honor to invite the Deputy President, Professor Kithure Kindiki, to come and make his remarks and invite His Excellency the President.
Kenya hoye! Kenya hoye! Mr. President, Your Excellency, colleagues, today is an important day for our country. We have struggled since our country was established to create a good country. We have struggled to modernize our country and improve the quality of life of our citizens. 16 years ago, we adopted a new constitutional order. The summary of that constitution envisages a Kenya which is democratic, but also a Kenya where the citizen is empowered economically. While we have made good progress on the democracy front, I think, Your Excellency, the last 4 years are extremely important for us because for the first time we have started deliberately making the first steps towards realizing a wealthier and healthier Kenya, which is an important component of realizing the dreams of the founders of our nation, the makers of our constitution, and the dream of a Kenya of the future. And so as I sit here to listen, Your Excellency, I relish to see the progress you have enabled us to achieve by carrying the people. Now we are talking of 32.3 million Kenyans covered with a medical insurance cover. This is phenomenal. We are looking at people getting medical advice from their homes and villages through the consequential 107,000 community health promoters, which continue to serve our nation well. I've just been with you as you went through what this administration is doing around medical equipment under the National Equipment Support Program, and also the consequences of the laws that our parliament has put in place. The Primary Health Care Act, the Social Health Insurance Act, the Digital Health Act, the Facility Improvement Finance Act, and the funds that are in place now: Primary Health Care Fund, the Social Insurance Fund, the Emergency Chronic and Critical Illness Fund, and the Facility Improvement Financing, or the Facility Improvement Fund. So, Your Excellency, I am a very proud member of your administration. I speak on behalf of so many of us who serve in your administration. I speak on behalf of many Kenyans who believe in your leadership, that we are looking at a very, very critical transformation of our country. And we can look at the people of Kenya in the eye and tell them, this government has lived to its promise and commitment to pull the people of Kenya from disease and to create a healthier country which can be the engine for the economic and developmental future of our country. Naomba kwa heshima wenzangu, tusimame, tushangilie Mheshimiwa Rais akuja atuongeleshe. Rais Ruto, ni fire si fire? Karibu Mheshimiwa Rais.
Asante sana Bwana Deputy President. Huyu Deputy President ni fire si fire? Tafadhali tuketi, asanteni sana. Thank you very much. Let's take our seats. Distinguished guests, ladies and gentlemen, there are promises governments make because they are popular. Others because they are convenient. And then there are promises a nation must keep because they speak to who we are and the country we intend to become. Universal health coverage is one such promise. For years, Kenya lived with a contradiction we should never have accepted, that access to health could depend on the size of a citizen's wallet. Illness could force a farmer to sell his livestock or sometimes his land. A mother could exhaust her savings, or a community forced to organize a fundraising simply to keep one of their own alive. Too often, treatment became a debt and sickness a pathway to poverty. That was wrong. It was also unjust. 16 years ago, through Article 43 of our Constitution, Kenyans made a solemn promise to one another. And that promise, the right to the highest attainable standard of health, was inscribed in our supreme law, and that no person shall be denied emergency medical treatment. That is not an aspiration. It is a constitutional command. That command informed the promise we made when I sought your mandate in 2022. Universal health coverage was one of the 5 pillars of our bottom-up economic transformation agenda, because economic empowerment means little when illness can wipe out a family's savings or push citizens into poverty. Yet, by 2022, barely 1 in 4 Kenyans had health insurance, and fewer than 1 in 20 among the poorest households. Millions paid out of pocket, borrowed, sold assets, organized harambes, or simply stayed away from hospital because they could not afford. Kenyans were spending an estimated 150 billion out of pocket every year on healthcare. The problem went beyond financing. KEMSA's order fill rate had fallen to roughly 40%. Medicines were often unavailable. Records remained paper-based. Claims moved very slowly, and facilities struggled for resources, while emergency care remained fragmented without a coordinated national response. We resolved to build that system from the bottom up, not to patch the old one, simply rename it or make another promise about it, but to fundamentally change it. On the 19th of October 2023, I signed 4 landmark laws that created the legal architecture for universal health coverage that replaced the NHIF Act. The Primary Healthcare Act strengthened preventive and community health care, while mainstreaming the place of our community health promoters. The Social Health Insurance Act replaced NHIF with SHA and established dedicated funds for primary health care, social health insurance, and emergency chronic and illness. The Digital Health Act established an integrated digital health system, and the Facilities Improvement Financing Act enabled public health facilities to retain and reinvest their revenues. Together, they transformed our healthcare in terms of financing, delivered and accounted for in Kenya, created the architecture through which we would finally translate Article 43 of our Constitution from a constitutional promise into everyday reality. We call this undertaking Taifa Care, as you all know. What followed has been transformational. And I would argue that alongside affordable housing, universal health coverage is one of the most consequential social transformations we have undertaken as a country. This achievement belongs, above all, to the people of Kenya. It is through your contributions, your taxes, and your participation that we have been able to make possible what our country has aspired for generations. Kwa hivyo, Taifa Care sio zawadi ya serikali kwa wananchi. Ni mfumo ambao Wakenya wenyewe wamejijengea kupitia reality. Across the country today, 107,800 community health promoters are going from household to household, equipped with smartphones and essential kits to find illness before illness becomes a catastrophe, to register households, educate families, screen for disease, monitor mothers and children, identify danger early, and connect families to facilities. More than 9 million households have been reached by our community health promoters, and over 750,000 people have been referred for treatment. For the first time, we have built a nationwide health network whose first point of contact is not necessarily a hospital bed, but the doorsteps of a Kenyan home. We are reversing the old logic of waiting for people to fall sick, finding hypertension before stroke, diabetes before complication, a high-risk pregnancy before the emergency, and disease before disaster. The national government continues to match county government contribution to CHP or community health promoter stipends shilling by shilling. From this level, when a patient requires further care, the next part of the journey begins. Through the Primary Health Care Fund, eligible services at level 2 and 3 dispensaries and some level 4 health centers are financed by government. So far, the fund has received 27.4 billion shillings in budgetary allocation and disbursed 23.3 billion to support more than 20 million outpatient visits, benefiting over 15 million Kenyans. As we said, walk in, receive treatment, walk out, just as we promised. And I want to commend facilities, both public and private and faith-based, for working with us on this endeavor. This is a fundamental shift. Prevent what we can, detect what we cannot prevent, treat early what we detect, and refer efficiently what requires specialized treatment. And when a Kenyan requires admission, surgery, or specialized treatment, the Social Health Insurance Fund provides the next level of protection, built on the principle that everyone should contribute according to their means and their ability, but no one should be denied care merely because they cannot afford it. That is why the government of Kenya has sponsored nearly 560,000 vulnerable households, covering approximately 2.2 million Kenyans, while Lipa Sha Pole Pole enables families in the informal economy to contribute progressively according to their circumstances and means. Today, 32.3 million Kenyans are registered with the Social Health Authority. 8 million have received treatment. More than 1.5 million mothers have been supported to deliver safely, and more than 500,000 surgical procedures have been supported and paid for. These are significant numbers statistics, as some would say, but behind every number is a human being, an anxious patient, a worried parent, a frightened child, a health worker doing everything possible and for a life to be restored or saved. Consider, for example, the case of Lydia, an 18-year-old student and her mother, Naomi Mutendwa Kilunda. When Naomi's assistant chief encouraged her to register with SHA, she enrolled and listed her children as dependents, as is required. She could not have known then how much that decision would matter. Lydia later developed severe breast overgrowth that affected her mobility, her confidence, and her life as a teenage girl. She required specialized surgery at Kenyatta International Hospital costing $168,000, a bill her mother could scarcely have afforded. But because Lydia was covered, her surgery was paid for, and so was her recovery. Today, she is back in school, preparing for her Form 4 examinations. Or consider Christine Awino Onyango, a 42-year-old widow from Kisumu County, diagnosed with stage 2 esophageal cancer. Until recently, Christine would have confronted two enormous burdens: the cost of highly specialized treatment on one hand, and the additional cost of traveling hundreds of kilometers to Nairobi to receive it. Instead, she received specialized care at Jaramogi Oginga Odinga Teaching and Referral Hospital, including surgery, intensive care, and post-operative management. Her medical bill exceeded $250,000, yet her annual SHA contribution was only $7,000. Her bill was paid by SHA. So, when people ask, what happened to the bottom-up promise, to the mama mboga, the border guy, the farmer, and the ordinary working Kenyan, I say this to them: look at Christine, look at Lydia, and consider the millions of Kenyans who can now walk into a health facility and receive care. What could be more bottom-up than that? That is the transformation we promised. It is the transformation we have delivered. But the journey does not stop there. For some Kenyans, treatment is not a single visit, or an admission, or a procedure. Cancer, kidney disease, and other chronic and critical conditions can require care for months or years, with costs capable of overwhelming a family and their entire savings. That is where the next layer of protection comes in: the Emergency, Chronic, and Critical Illness Fund, established to ensure that prolonged or critical illness does not become a sentence to financial ruin. The same fund protects Kenyans when care cannot wait at all. In moments of emergency, when someone collapses, when a child cannot breathe, when there is an accident on our roads, or when a mother develops complications during a delivery, nobody has time to compare prices, search for telephone numbers, or negotiate deposits. That is why earlier this month, we launched the SHA 922 Lifeline and National Ambulance Dispatch Center. A free call connects a person in distress to emergency care with evacuation and the first 24 hours of stabilization covered whether or not the patient is registered with SHA. No deposit, no guarantee, no relative running around one office to another looking for money while a life hangs in a balance. And this is because Article 43 of our Constitution does not say emergency care is available only to those who can afford it. It says, no person shall be denied emergency medical treatment, period. We are finally giving practical meaning to those words. Financing patients is only one side of universal health coverage. The other side is the facilities treating them, which must function. Through the Facilities Improvement Financing Act, public health facilities and all other facilities can retain and reinvest their revenues in medicines, equipment, and better patient care. Since October 2024, Social Health Authority has received more than 209 billion and paid out 178 billion to contracted facilities across 47 counties. KEMSA's fill rate has risen from approximately 40% to, as you have seen in the numbers there, 91%. That is commendable progress for KEMSA, but our destination still remains 100%. That is why we have recapitalized KEMSA with Kenya shillings 1.5 billion and extended a Kenya shillings 10 billion credit line to strengthen the supply chain in KEMSA. Ladies and gentlemen, digital health is the backbone that holds much of this architecture together. The old system was not only inefficient, but its opacity created opportunities for people to profit from its weaknesses. We had claims for procedures that never happened, fictitious patients who did not exist, inflated bills, and many more. We even encountered the absurdity of claims for the amputation of patients' legs several times, as though the same leg might have somehow grown. That was not healthcare, it was theft. And it was theft from sick people. That is why the Digital Health Act is so important. And you must have seen a huge campaign that was undertaken against the digitization of health. In fact, many headlines were written, sponsored by those who benefited from these schemes as to how expensive it was, how unworkable it was, and how it was assigned to some people and that kind of thing. Digitization is not simply about replacing paper with screens. It is about making every patient visible, every treatment traceable, and every payment accountable. Let me repeat. Digitization is not simply about replacing paper with screens. It is about making every patient visible, every treatment traceable, and every payment accountable. That is what it does. And as I have said, this whole process, the heart of it is our digitization process. For the first time in independent Kenya, we have put in place a comprehensive legal framework, financial architecture, institutional framework, community and digital architecture for universal health coverage, built and sustained by the contribution of Kenyans themselves. We have crossed a historic threshold. Just imagine what we have done. You know, when we asked the people of Kenya that we need to change the contribution metrics so that instead of contributing a fixed amount, let us contribute a percentage of everybody's income. The difference is what you see. We have done so together. I thank our governors and county governments for working hand in hand with the national government to make universal health coverage a reality across our country. And I say this with a lot of humility, that without the participation and the partnership of our county governments, this exercise would have been very difficult. And again, my good friends, the governors and the counties, I want to request you to stand up so that we can do a round of applause to all our counties. Tuwapigie makofi jameni. Thank you very much. You can take your seats. You were not so much interested in where the national government functions and the county government functions stopped or began. Collectively, we were interested in the health of the people of Kenya. And that is why this partnership has given us this result. This is the partnership and the cooperation between our two levels of government that our Constitution envisaged. In our midst, we have also our members of parliament, who I very sincerely thank for debating and shaping and passing the laws that underpin this reform process, as was ably enumerated by the Speaker. Again, to our members of parliament, in both houses, those of you who are represented here, if you can stand up. We have members of parliament in our midst. Thank you very much. Thank you very much. We have both the chair of the Senate and the chair of the National Assembly in our midst. Asanteni sana. Please pass my regards, best wishes, and thanks to all the members of parliament who, across the aisle, debated these bills, made their contribution in formulating a sound legal framework upon which today we are undertaking this most consequential and transformational program in Kenya. Let me also, in the same spirit, thank my cabinet and principal secretaries. They have put in many hours under the leadership of the Deputy President to streamline and in a very consequential way made proposals on the improvements that were required, that were initially captured in our manifesto and progressively shaped into bills that went to Parliament. Again, Mr. Deputy President and my cabinet team and the principal secretaries behind you, simameni tuwapigie makofi. You guys have done a wonderful job. Asanteni sana. I really appreciate your support. But crossing this threshold does not mean the work is finished. It means the question before us has changed. No longer whether Kenya should pursue universal health coverage. That we have crossed that Rubicon. But how we make it work even better for every patient, at every facility, and in every county. That is the task ahead of us now. And we must be candid. We know that there are areas to improve, including making registration easier, benefits to be made clearer, claims faster, digital systems more seamless, and the quality of care more consistent. Because the ultimate measure of reform is not the laws we pass or the numbers we register, but the experience of every patient in terms of dependable, affordable, and dignified care. That is the measure. And we all know reform is not an event. It is a continuous journey of closing the distance between the promise we made and the experience of every Kenyan who seeks care in all our facilities. Ladies and gentlemen, this summit also comes as we begin a wider national conversation on the Kenya we intend to build beyond Vision 2030. Your contributions over the next 2 days will therefore do much more than improve universal health coverage today. They will help define the healthcare Kenya should guarantee to its people beyond 2030. Serious nations do not start again every 5 years. Governments will change, but a Kenyan's right to health cannot change with them. We can improve what we inherit and correct what does not work, but we cannot tear down progress without an answer for what comes next. Universal health care must become part of our national covenant, not an achievement of a government, a party, or a president, but of the people and of the Republic. That is why the National Development Charter matters, so that our children begin where we finish, not where we began. We have come so far, and we have further to go. Let us use these 2 days to strengthen what we have built, improve what can work better, and safeguard for generations what Kenyans themselves have made possible. I want to thank all the participants. I am looking forward with great anticipation for the next 2 days, so that we can do a stock take of what we have achieved, agree on areas that need improvement, and consolidate what we have gained into progress that can be built on by generations that come after us. It is now my honor and privilege to declare the Kenya Health Summit 2026 officially open. And congratulations. God bless you all. God bless our great country. And I thank you. Asanteni sana.
Another round of applause for His Excellency, please. Your Excellency, with your permission, if you may, if I can seek your indulgence, kindly let's take our seats. We'd just like to take a few photos that will help us mortalize this day. Allow me, Your Excellency, to invite His Excellency, the Deputy President, the PCS, Speaker, CS Health, and the two PSs for Health kindly to be part of the photos as we progress. The two PSs kindly. And let's proceed to the left of the stage and join in. Actually, let's join in, all governors present. We can balance with some coming to this side, please. We carried wide lenses today, so we'll all fit. Wonderful. And while all governors, you may take your seats, please. Let's have all CSs and PSs present, please, to join in. CSs and PSs present. Yes. Thank you. And the last photo is all ambassadors present, please. So CSs and PSs, kindly take your seats. All ambassadors present, please, to join. And we have the last photo. While I take this opportunity to invite Dr. Mercy Korir, who is going to be continuing with the plenary after this. So while we finish, we'll allow His Excellency to exit, but the rest of us will remain to kindly proceed with the plenary. Ambassadors, you may take your seat. Allow me, Your Excellency, to just have the members of Parliament, particularly the committee who have made this possible as the last photo. Dr. Mercy Korir, if you kindly can come forward after this.